Welcome. I'm Dr. Joanne Hoffman, one of the pediatricians at South Lake Pediatrics. South Lake Pediatrics works hard to be an innovative pediatric practice for our patients. Today, our parent education program focuses on improving mental and physical health through good choices and activities. Our presenter is Dr. Julie Ewasiuk, a pediatrician at South Lake Pediatrics and a mom herself. Julie has a passion for many activities, including running, biking, and curling. Her talk is full of tips and advice for busy parents, and it is titled Move Your Body, Help Your Mind. Welcome, Dr. Ewasiuk.
Thank you, Dr. Hoffman. Everyone knows that eating a healthy diet, getting exercise, and enough sleep are important for our physical and mental health. Studies have shown that healthy kids grow into healthy adults. As a pediatrician and mom myself, I know it's not always so easy to motivate our kids to make the healthy choices we want them to. In this talk, I'm going to focus on how being active, eating right, and sleeping well can help to both prevent and to treat mental health disorders such as depression and anxiety. But I also hope to give you a few ideas on how to motivate your kids to get their bodies moving, make healthy eating choices, and to sleep well. There are many known benefits to getting regular physical activity. Moving your body in a way to get your heart beating faster and you breathing heavier helps to build healthy bones, muscles, joints, and your heart. This increased blood flow also reaches your brain and has many positive mental health effects. Getting regular exercise helps to lower levels of anxiety and can elevate your mood. Getting regular exercise also helps to improve thinking and focus and improves kids' school performance. Regular exercise and being part of teams helps to increase self-esteem and build social skills and connection, which are important for kids and teens. A healthy body helps to create a healthy mind. This has been scientifically proven. There is one study that looked at the treatment of depression and anxiety and the effect of exercise versus therapy. This study split the treatment into two groups. One group was treated with traditional therapy 1 time a week for their depression and anxiety for 10 weeks. The second group was treated with exercise alone. These participants were asked to move their bodies for 20 minutes a day, 3 times a week. At the end of the 10 weeks, both groups had equally decreased levels of depression and anxiety symptoms. There have been many studies looking at how regular exercise improves school performance in kids. I recently came across another study that looked at the effect of COVID-19 on our teenagers' mental health. This study kind of measured the self-reported psychological distress score of teenagers in the pandemic. Not surprisingly, there was a high level of reported psychological distress. However, the teens that were able to move their bodies for more than 60 minutes a day had a much lower rate of psychological distress during this time period. Electronic devices or screens have become a useful and integral part of our lives. This time during COVID-19 has really showed me how screens can be used for so many pieces of our lives, such as education or connecting to others. But I think we all can agree that our kids are on these devices too much. Do you think your kids are using too many screens? The problem with screen time is not the time that is spent on the screens itself, because the screens can be a great way for kids to connect with their peers, especially when they can't be physically with them. They can also be a way for kids to educate themselves and to answer questions. However, I like to think about time spent on screens as time that they're not able to do other activities to keep their bodies healthy. This data is from 2017, and you can see that screen time has really become the primary activity for our kids during their free time. In 2017, kids spent an average of 18 hours a week on screens, which was much higher than all the other activities they spent during their free time. I would guess that this number is much, much higher today. The increased time on screens is also associated with higher rates of depression and anxiety in teenagers. So what are some ways we can encourage our kids to be more active? Organized sports and activities are a great way to keep our kids active. The set practice and game times guarantee that your kids will be active for a certain amount of time each week. When kids are part of a team, they have connection and camaraderie and can have higher rates of self-esteem and confidence associated with being in these activities. However, organized sports and activities may not be for all kids. We also know that participation in these activities decreases as kids get older. And it's important as your kids are deciding not to participate in organized sports anymore to help to find ways to keep their bodies moving and active. With anything, whenever you start a new exercise program or activity, it's important to start small and increase your activity level gradually. If you go too fast, you risk injury and you also risk getting burned out from an activity. The frequency of being active is more important than the duration. It's recommended that kids and teenagers move their bodies for at least 60 minutes a day. Only 1 in 4 kids or teens meets this goal. It's important to think about that you don't have to do this whole 60 minutes in one big chunk. It can be a combination of many different activities to get to the 60 minutes. You can spend 10 minutes walking your dog and 10 minutes shoveling the driveway and 30 minutes playing outside tag with your neighbors and maybe shooting some hoops to get to your 60 minutes. Free play is also really important for kids and provides different skills that organized sports and activities do. Our kids are all unique and wonderful individuals made up of a whole bunch of different personality traits. I think it might be useful to think of your kid's fitness personality when you're trying to find an activity or a sport that's a good fit for them. There are three main fitness personalities. There's the athlete who naturally enjoys competitive athletic teams. They may thrive with organized sports. There's a casual athlete who really enjoys being active, but may not be as into the competition piece. They may enjoy the fun and friendships that being on a team sport provides. And then there's a non athlete. They may not naturally want to move their body. They may need more encouragement to stay active. The priority for them should always be for fun. Your child may need to try a variety of different sports and activities until they find a good fit sport for them. You can also think about your kid's fitness personality in the different ways that you can support them. An athlete may easily declare their favorite sport and have a lot of internal motivation to practice and play that sport all the time. They may not need your encouragement to stay active, but they will need a lot of support from you as a parent to foster their athletic goals. They also may need some help in deciding on, may need some help in coaching on balance because they may want to focus all their energies into one sport. And we all know it's good to have a variety of different activities. The casual athlete may need to try several different sports until they find a good fit. They're not naturally as competitive as the athlete, but do enjoy some competition. But their primary focus of athletics should be on fun and friendships and being physically fit. It's important to recognize that the casual athlete may be easily discouraged if they feel that they're not good at something. One way you can help with this as a parent is to play catch with them in the backyard, to spend some extra time working on those skills and encourage them to continue with the sport, even if they feel discouraged. The non athlete can be harder to motivate. They may lack interest or ability or both. They may just naturally have a more interest in sedentary hobbies such as music or the arts. But it is important to find a way to get these kids active and to make these um, activity a priority for the rest of their life. They may need lots of encouragement to initiate and maintain activities. One idea to get a non-athlete moving their body is to train for a family race together. There's so many different opportunities for racing, and distances can range from being very short up to longer distances. You can do a training plan together and race together. And at the end of the day, it's such a great sense of accomplishment and self-esteem boost for your family together. Instead of watching TV as a family after dinner, you can go on a walk or shoot hoops or ride bikes. I really like this idea of embracing boredom. We live in a fast-paced society where we are used to getting answers right away and used to being entertained all the time. But I think it's really good to turn off the screens and let our kids sit idle for a while. If left alone, a lot of kids will naturally find something to do, and a lot of times that naturally is moving their bodies. You can help to motivate your kids by doing simple challenges. Challenge them to race down the block and see who's fastest. See who can do the most sit ups in a minute. See how many times they can do the monkey bars. You could have them set up an obstacle course in the backyard. Remember that kids are always watching what their adults do. So make being active part of your family's routine, and it will be much easier to keep your family active. One of the best pieces of parenting advice I like to give is Be the person you want your kids to be. The connection and community that athletics provide are really important to our mental health. This connection and community can be accomplished by being part of team sports. But if your kids are not sports minded or maybe tend towards being interested in different activities, it's important to find ways to keep them connected and to foster this. People who are connected have a sense of purpose and belonging um, from being part of that group. Kids who are connected have lower rates of depression and anxiety, there's lower rates of suicide, and they are reported to be happier. There are 3 character traits that are needed to succeed in life. These are hard work, resilience, and self esteem. All of these can be achieved through being physically active and involvement in activities. So take care of yourself and your kids and get out and be active. Now I'm going to talk about sleep. Sleep is really important to the maintenance of our mental health. Sleep requirements vary by age. Elementary age kids need 9 to 12 hours of sleep at night. Middle and high school kids need less, 8 to 10 hours at night. Sleeping too little can cause a lot of problems. You can have trouble focusing, trouble with concentration, you can lack motivation and be forgetful. It can take kids who are sleep deprived much longer to do their homework. Kids who are sleep deprived can be irritable, impulsive, overly active, or restless. Sleep deficiency has been linked to depression, suicide, and risk taking behavior. So, how do I promote sleep in my child or teenager? It's important to set a consistent routine and consistent bedtime. Limiting electronics before bed is one way that can help us to fall asleep faster. You can set a family rule to remove electronics from the sleep space and to charge all phones and electronic devices in a common area at night. You may have more success with this if the parents even follow this rule. One thing I often hear is that teens say, "But I use my phone for my alarm clock." Well, guess what? Target sells regular alarm clocks, and so they don't need to have their phone in their rooms for that purpose. Some teens also like to listen to music or podcasts on their phone at night, but you don't have to have a phone to do this. You can get an Echo Dot or a speaker to play these things for them. One way to get your mind ready to go to sleep is to do relaxing activities before bed. You can do yoga or mindfulness or even just read a book or do a puzzle. If you use a screen before bed, the problem is that it interferes with your body's natural release of melatonin. Melatonin is a sleep hormone that gets your body ready to go to sleep. Sometimes supplements and herbal remedies can help if your child or teen is still having trouble falling asleep despite having a good bedtime routine. It's best to talk to your pediatrician about these before starting them. Some children and teens are getting the adequate number of hours of sleep, but are still not being well rested in the morning. This can be a sign of a sleep disorder. Some signs of this are snoring, restless sleep, acting tired in the morning, and frequent night wakenings. If any of this is happening, talk to your pediatrician, and we can help to diagnose sleep disorders in your kid or teenager. Lastly, I'm going to talk about nutrition. Kids who eat a diet full of whole, healthy foods, including fruits and vegetables and good protein sources, feel better mentally and physically. It's best to avoid processed foods. They're often filled with extra sugar and empty calories that don't help to provide the energy and nutrients that your kids need to grow and to perform. However, it's important to recognize that in times of stress, our bodies tend to crave carbs. But a diet full of processed carbs and sugars can worsen our mood. Many studies have shown how important family dinners are to our teenagers and kids' mental health. Families who eat one meal together a day are much more connected to each other. Those kids have higher self-esteem and self-confidence, and there's lower rates of mental health disorders in this population. I think it's important, though, as our life gets back to normal and we're busier, that this family meal doesn't have to be at dinner time. Some families find it easier to connect at breakfast. The important thing is sitting down together one time a day and eating together. In closing, establishing and maintaining healthy sleep, exercise, and diet habits can help to prevent disease, but are also play an important role in the treatment and prevention of mental health disorders such as anxiety and depression. Start small and commit to making positive changes one step at a time. and you will notice benefits for both your mind and your body.